said, the bronchial sounds will be heard mostly over by the trachea. When you go lower, below the clavicles, that will be where you will hear the bronchovesicular sounds. And here below the, by the inferior area, you will have the vesicular sounds. Okay, try to imagine trachea, then it bifurcates, okay, and then you have the lungs in this area all the way down here. Okay, so bronchial, bronchovesicular, vesicular. Now here is one thing that you need to remember. Please make sure that, again, the diaphragm is in contact with the patient's skin. Okay, now we do not need to ask our patient, take a deep breath, deep breath. Okay, because you will need to assess very carefully these different areas, comparing one side to the other. Okay, now by the time you go to you reach the lung periphery, the patient will be, I'm feeling woozy. Okay, so just, allow the patient to breathe normally. Do not rush. Like doctors, they go. I don't think they even heard anything. There's not even an inspiration. There's no expiration, and they're moving from one to the other. Okay, so you have to be a little more organized, more systematic. Listen, okay, to one spot, compare it to the other. So we just need to tell our patient, just relax, breathe normally, and when you're hearing something, oh, I think there's an abnormal breath sound, then maybe you can ask the patient, take a deep breath this time and see if you will be able to really appreciate it. Okay? So, let's relax. Okay, so bronchovesicular. Bronchial. You listen to it, you will be able to appreciate it. I can hear her vowel sounds also. Okay, now posteriorly, can you put down your hands and then hunch forward? Okay, so again, we said that here, below the clavicle and between the scapula is going to be the bronchovesicular. You will not appreciate the bronchial sounds on the posterior aspect, so just the bronchovesicular, and then you have the vesicular. Okay, so all clear, no lungs? Lungs are clear.
No lungs?
Lungs are clear. Okay, so if you hear adventitious or there's abnormal breath sounds, then ask the patient, take a deep breath, so you'll be able to identify what those breath sounds are. Okay, so this is for the thorax and the lungs. Any questions?